Hi, and welcome to this week's episode of Ask Dr. Jessica. I'm so excited. We have Brianna Battles here today. Hi, Brianna.
Hi.
So let's get into it. So first, tell me, who are you and what led you to do the work that you do?
Yeah, I'm Brianna Battles. I'm the founder of Pregnancy and Postpartum Athleticism. And that means that I coaches, practitioners, and pregnant and postpartum athletes. So I do have certification program for the professional population, but then I also have resources and paid programs for kind of like everybody else who wants to train during pregnancy and recover well postpartum so that they can do the kind of fitness that they want to do. And I knew that it would be really healing and fulfilling to take my knowledge and experience as a strength and conditioning coach, knowing how to coach people and helping to serve this population. So I did that with pregnant and postpartum athletes, but then was really able to evolve that with coaching the coaches and practitioners and professionals because they have such a greater reach and impact. They are out there in their communities offering a lot of services and information.
Now, you described in your first pregnancy that you did exercise and you exercised, impressively. But what did you do that you wanted to improve from that first pregnancy? Because it sounds good that you exercised, you were continuing with your athleticism and your quest for being healthy. So what, in retrospect,
Right.
what did you do that you wanted to improve?
Yeah, so I think it's exercise is beneficial. It is an excellent way to navigate pregnancy and postpartum. And with that, it also needs to be adjusted for the changes your body is going through structurally. So as your pregnancy continues, your abs will separate to create space for the baby. That's called a diastasis. There's also added pressure on the pelvic floor. And so a lot of people will experience symptoms like incontinence or pelvic organ prolapse or really significant diastasis, which was something that I experienced postpartum. It's really learning how to walk that line, being willing to adjust our exercise approach so that we're taking into account what our body will experience during delivery, regardless of how the baby comes out, and make progress postpartum because there are so many postpartum people that really struggle to recover postpartum because of what their body has experienced. And there's a lot we can do, I guess, during pregnancy to create awareness around our changing body and what that will be like postpartum. I shift my messaging into athletes a lot because I get a lot of CrossFitters. I get a lot of, moms that want to be in boot camp 4 to 5 days a week or that are really driven to have a certain aesthetic or whatnot. Like I work with a lot of those people, but the messaging and information is really transferable kind of to everybody. My definition of an athlete is anybody who's pursuing fitness across a spectrum of interest and ability. So it's not just the UFC fighter or the Olympian or the CrossFitter. It is really anybody who's trying to have a relationship with fitness. And with that, during pregnancy and postpartum, our bodies change. Our exercise has to reflect that change and respect that change in order to have that lifetime of fitness and athleticism.
So let's say like I will say a regular mom like me, someone who's not really an athlete, or I guess in your definition, maybe a little bit of an athlete, someone who enjoys exercise and wants to continue exercising. What would your general philosophy and approach be for a mother like that?
Yeah, I think it's to really understand your body during that season, that doing something will, in most cases, be better than doing nothing unless contraindicated by your OBGYN. But moving your body doesn't have to be really complex. There's a lot of value in strength training as far as managing pain in like your ligaments and your joints with your body changing. And don't be afraid to lift weights. Lifting weights is good. There's no, again, unless contraindicated by your OBGYN, you're not limited to lifting under 20 pounds or anything like that during pregnancy. Should you be lifting 300 pounds? Well, like probably not. And that's really the range of people that I work with. So that's not even like that extreme of a scenario in my world. But I think that there is, I think for the average exerciser, some fear around, well, what about my heart rate or how much weight am I allowed to lift and things like that. or they have like maybe like some nagging pelvic pain and they're not really sure what to do, but well, I'm just going to keep walking. Sometimes walking can really aggravate a lot of that pelvic pain. So what adjustments can we make during that season to encourage movement, to encourage exercise without creating any potential symptoms? And that's just knowing how to manipulate what you're doing to respect where you're at right now.
Do you notice a big difference in women that maintain exercise throughout their pregnancy?
Yeah, I mean, we've seen a huge pendulum swing, right, of information and messaging. I know my mom was certainly not throwing around barbells and trying to like run when she was pregnant with me 30 something years ago. But now it's not uncommon to see a headline that's like 8 months pregnant, completed a marathon, or like, some CrossFitter who has a viral video at 40 weeks pregnant. Like we see those extremes and we also can recognize just how far that pendulum has swung. And I really, again, try to encourage it to come back to the middle. Now, there's a lot of things in pregnancy we cannot control and postpartum that are just unfortunately so far outside of our control. What we can choose to control is our exercise approach. And like exercise, I will always encourage that because it is such a healthy way to, I mean, I look at it this way. I'm not the same person I was 10 years ago. I'm just not. Like my lifestyle is so different. What I'm doing is so different for work. My at home life, maybe my body, like these things are different than they were 10 years ago. And it's going to be different 10 years from now. Let our exercise and our approach to health and fitness evolve with us through our lifetime. If our goal is to be an active grandma, like let's just roll with it to the best that we can, have a really healthy relationship with our approach to exercise through all seasons. Pregnancy and postpartum just kind of highlights a huge identity shift. But again, our identity has been shifting and our life has been changing. We just didn't really, it just wasn't as blatant, I guess, as it is when like, oh God, now there's a baby or now there's an additional baby. Like those are really like revealing seasons of change, but we're changing anyway. And again, if the goal is to pursue health and to pursue fitness throughout our lifetime, it's doing what you can to stay in the game, right? To stay in the game of fitness and health, and it's respecting that, hey, pregnancy, your exercise might look different. Maybe you're so sick and so fatigued for 6 months that it's just not a priority, and give yourself grace, because I want you working out and feeling good 6 years from now. That's what's really important. And I mean, you don't have to wait that long, but it's keeping that perspective of this is a temporary season. It's not forever. It's just for now. And postpartum, you're dealing with symptoms. Well, there's a lot we can do to improve those symptoms so that, again, you're feeling really good 6 months from now and 6 years from now. Cool. Like, let's address that. There might be a time where you're injured or you're recovering from a surgery, or there's a huge shift in your family dynamic. Like, respect that season and know that exercise doesn't have to be this all or nothing. It can keep evolving with you throughout your lifetime.
I agree. You have to give yourself grace and honor time after pregnancy, and just know that it takes time to get back to quote unquote normal.
Right. And, and it's just such a shifting normal too. I think we've been told that, well, you can have a flat stomach, and maybe that's true for some people. There's so many factors that play into that. Your body will shift and change, and it doesn't have to be for worse. And it may not be like exactly what it was before either. And that's okay. Because again, do you look exactly the same as you did 10 years ago? Maybe similar, but probably not exactly the same. Just like we won't look exactly the same as we do 10 years from now, regardless of the amount of fillers and Botox available, right? There's just natural changes that happen through our lifetime. And when we're that critical, it robs us so much from, I guess, from the joy, and I think there's a lot I wish I could do differently when I think back to my first postpartum recovery with Cade, because I was so focused on I don't want to look like I had a baby. Like that's something I told my friends all the time. And I was very vocal about it. I just don't want to look like I had a baby. And that's just that's such a harsh thing to say and to believe, really, and the sentiment was I wanted to perform like I was before. I wanted to be doing the kind of fitness and the routine that I was doing before. And I wanted to look pretty similar to what I was doing before. And we can have a lot of those things, but it's not going to be exact. And we have to give yourself grace to stay in the moment with adjusting to that lifestyle and know, again, that fitness will come with you, but it doesn't have to be something that robs your current either. I see so many
Right.
moms that are like, okay, you're cleared for exercise. I'm going to go out and run and I'm going to do a bunch of abs and I'm going to try to get my body back really fast. And they become so focused on that piece and so mean to themselves. Like they look in the mirror and they're like, oh, I'm disgusting. Oh, and they like pull on this, or they try to take transformation photos to hold themselves accountable. And while it's not always like, self-sabotaging, it does take away an element of just, hey, I'm postpartum. This is exactly what I'm supposed to look like right now. And my body will keep changing. And we know we physiologically go through significant changes at the 4 month mark, around the 6 month mark, around the 9 month mark, around the 12 month mark, around 18 months postpartum. Like we will naturally sort of fall back into a rhythm. But when we're forcing that, that can cause a lot more mental health um, like struggles and can create core and pelvic health symptoms because we're doing too much too soon on a healing body.
So what would you tell like the general mom out there that's listening that, they might scroll on Instagram and see all these moms that look perfect
Yeah.
postpartum, they've had a baby 2 seconds ago and they look great already in the bikini. What what would you tell a mom realistically to expect or how to prepare mentally if you could give a mom advice?
Yeah. The to be very candid, the people that are sharing that side have a lot more going on that they're just not sharing when they're trying to, and because I was that person, but when they're showing like what they look like or their progression or whatever, you just don't know the full picture. And I'm yet to meet a mom who has not struggled with something postpartum, whether it's her mental health, whether it's recovering from birth, whether she's peeing herself every time she sneezes, or when she goes out on a run, or she has pelvic organ prolapse, she feels like something's falling out of her vagina all the time, or she has stretch marks, or she has stretched skin. Like every mom has something going on. Maybe she's struggling with breastfeeding. Maybe her baby has a condition that she's still trying to wrap her head around. Nobody gets out like unscathed. It just kind of depends on the degree. And so to have that superficial Instagram preview, like you just don't know the whole story and you cannot compare yourself to people on the internet. Just don't.
That's a good rule number one.
Yeah. Yeah, because I mean, we all choose to share the highlight reel. We're not going to show necessarily share the lowest of lows, and if we do, it's usually when we're on the other side of that low. And that's what I see a lot working with this population is, we all try to put up this front initially because it's such a huge change. Um, but then there's still a lot of silent battles that are going on and things that we're like kind of learning through the trenches that maybe we're not even aware of until a year later. And that was my case. I had no perspective really until it was a bit later. And then I was able to kind of look back and go, huh, like I wish I would have approached that differently. Or I can see that that actually wasn't healthy, but it was disguised as health. Like you get some more insight, the more I think like maturity you have navigating these seasons.
I think that's absolutely true. I mean, I think for myself, I think exercise isn't so much to change how I look, but I've noticed for me, exercise gives me so much benefit to how I feel afterwards.
Yes.
And so that's become my motivation. I really feel like exercise in some ways is the fountain of youth.
Mm-hmm.
If I do it frequently and I have a routine and I keep up with it, I feel so much better, just how I feel mentally. Um,
Absolutely. And
and
we
it's
know that, right? Like the evidence supports that for like good for aging well, for fighting off like disease in at least the ways we can control, for our bone health as women as we age, for our hormonal health. Like we know exercise is beneficial. So pursue a lifetime of athleticism without it like controlling you. I think that's the biggest thing is like have it complement your life, not control your life. We already have too many things going on. We don't need that to become an obsession point. We need it to become a joyful point.
so I'm just wondering, in terms of mothers and exercise. You were saying before that, even walking can be too much at some point. Are there certain types of exercise that you really believe in? You mentioned weightlifting. Do you have any general philosophies for women that are pregnant that you encourage?
Yeah, I mean, look, I'm a career strength conditioning coach, so my bias is there should be strength and there should be conditioning in all aspects throughout our lifetime, right? How we're pursuing strength and conditioning will need to adjust during certain chapters. So I don't necessarily encourage a lot of like super heavy load of lifting during pregnancy or endurance training necessarily during pregnancy. So something like, my runners really struggle because they want to keep running. It's a huge part of their identity, but that repetitive impact on the pelvic floor can create potential symptoms. And so again, if I want to encourage running postpartum for this athlete, I'm going to tell them to probably cut back on some of their distance or just their overall volume and intensity of running during that season. Can they still do cardio? Yes. Are there a ton of different cardio options where they're still getting that fix? It might be different, but again, it's prioritizing that long game of being able to be a runner without the potential of aggravating a lot of symptoms during pregnancy. There's no need to push a lot of boundaries there to maintain. It's really just about adjusting to your changing body and the structures that are influencing your core and pelvic health. So just honestly, like training well below your max levels of strength, being able to scale back some of your cardio and your intensity, being able to, I came up with an expression the other day that was like, you want to feel breathy when you work out, but not experience breathlessness. So it's okay to be out of breath. And that 140 beats per minute that gets thrown around, that's super outdated. So you can get your heart rate up, but should you be trained to the point of exhaustion? No. So like really, it's about moving your body well in a way that, that feels good. Pursuing fitness that you enjoy without having to push those boundaries of load, intensity, volume, etc.
I like how you really think about the long game. I think that's so
Yeah.
important.
I think what resonates with a lot of people is being able to zoom out of pregnancy or zoom out of the first 6 months postpartum or even zoom out of the first year postpartum where our body is recovering from a significant physiological event and be able to say, okay, but I want to be running when I'm 2 years postpartum, or I want to compete at the Olympics, or I want to play with my grandkids and never feel limited. I want to be able to go on hikes with them. I want to be able to carry them, and really being able to say, like, is the fitness I'm doing now in support of the rest of my life? Not just right now, but it's all baby steps toward that.
It's such a great philosophy.
Yeah, I think there's a lot of rigid belief systems around what constitutes good exercise or good enough. So then we get into this all or nothing mentality. Well, if I can't do it this way, then I'm not going to do it at all. And there's unfortunately, so maybe it sounds ridiculous to some of you listening, but that there's so many people that are like, well, if I'm not able to run 5 miles, then it's just not even worth it, And so I think it's really being able to renegotiate what constitutes good enough exercise for the different seasons that you're in. My mom was one of those people. She was a single mom. She worked 3 jobs to raise my sister and I. Exercise was not on the table for her until my sister and I got into college, and she was like, I think I'm going to go on a bike ride. I think I'm going to and like now she's like legit a master's CrossFit athlete who kills it. Like she's way more CrossFitty than I could ever be. It's just so funny that she's now 63, that she's now pursuing her lifetime of athleticism. But it was not like that when my sister and I were growing up. So, it's never, ever, ever too late. So first of all, like if you're somebody who hasn't worked out in 20 years, it's okay. Like there is a starting point for everybody of any age and given ability. And, I think that there's a lot that can be done during all seasons of life to encourage exercise. It doesn't have to be an hour in the gym. It can be a 15-minute workout. It can be increasing your daily movement of just like, I'm going to go out and I'm going to walk. Like just basic physical movement without it being structured exercise has such positive carryover for our physiology. Following a training program doesn't have to be a 5-day, 6-day a week commitment. It can literally be 2 to 3 days a week, and that has sustainable carryover. So it's the sum of our habits, not just what we're doing during like a 21-day detox or like new year, new you kind of vibe. Like what is sustainable instead of cramming everything into a 30-day challenge or a 90-day challenge or whatever it might be. It's really kind of increasing our overall movement habits and knowing that it's okay if you didn't work out at all this week, you can start again next week.
I completely agree with what you're saying. I think you can still get that mental clarity, that feeling of endorphins from a simple walk
Yeah.
down the street, or the key is trying to figure out how to move your body within the day-to-day if you can't find structured
Right.
time. I mean, structured time is great if you can do it, but the
Right.
reality is it can
Right.
be
And
really
I mean, I
difficult.
think we can all find structured time like 2 days a week. And if we go in saying like it doesn't have to be 5 days a week, like give yourself those 2 days and you have flexibility around that. Say like, okay, like, you know what? I think it's going to be Tuesday, but if it's not Tuesday, can it be Wednesday? Like, yeah, like we
Right.
can find that. We just have to make our life fit around that to the best of our ability. Will that work every day? No. But can that work a handful of days a week? It absolutely can. And again, it doesn't have to be a whole hour. It could be 15 minutes of you just working through a body weight circuit or with some basic dumbbells. Or if you're somebody who's doing CrossFit, like, cool, go do like your compound lifts and a couple accessory movements. And like that is good enough because that adds up over time.
The other aspect I think about is that your children are watching you. You know, your
Yeah.
children will also emulate what you're doing. So if you're a couch potato, I think your children will likely pursue, have the same
Yeah.
habits. But if they see you
Absolutely.
moving and enjoying exercise, they'll likely follow suit.
Right. I know. Cade was so funny the other day. He was like, I think you need to go work out. I was like, I think you're probably right. I understand why you're saying that. It's a little bit of a diss, but it's fine. But they know that I'm going to go like, so for me, and something I would encourage people to do, especially with just the changes we've seen through the pandemic, is to have some fitness equipment at home, like a set of dumbbells or like a few things that you can use to help support some of your fitness. But I have a garage gym built out and I love that thing. But I'll go into the garage and the kids can be working out there. They're around me. They are annoying for sure. Like, but don't let that be a barrier to you not doing something. It's okay if you have to stop your workout halfway through. It's okay if you don't finish your workout. It's okay if your intensity is like literally nothing because you're having to get another snack or you're having to change a diaper or you're having to do whatever, like all or something. Not
It's
all or
still
nothing,
something.
just all or something. And that will yield you the most sustainable, healthful results and approach through your lifetime.
And it's realistic.
Yeah, I mean, like, what's the alternative? Like that's what I tell myself too. Is the alternative to this is not really feeling good, not having like a clear brain space, and I need that. I need to have my time. I need to do something for me if I'm going to show up for my business, if I'm going to show up for my kids, and if I'm going to try to be like a healthy human being. Like I have to do something that takes care of my body.
Absolutely. So, a couple last questions.
Yeah.
I'm just curious, how did you name your podcast, the Practice Brave podcast? Where did that name come from?
Oh, well, because I was really afraid of having a second child after what I had gone through with a traumatic delivery and just a lot of struggles that first year postpartum. And when Jared and I were thinking about having a second child, it was like, oh, you have to be brave. You have to be brave. And I was like, I am brave. I don't know how, but I don't know how to do this. And I don't even remember where it came from, but it was like, okay, I don't have to be brave, but I have to practice being brave. I have to like take the steps toward being brave. And that really guided me through my pregnancy, where then I was able to have a conversation with a new OBGYN and help tell her what my fears were, tell her what my wishes were. And I like reaped the benefits of that, of being able to advocate for myself, of being willing to have conversations, um, have a totally different birth experience and support that second time around. It was so affirming to know that it wasn't just, well, you got to be brave. Like you just got to show up and be brave. It was just the small steps toward what you ultimately wanted and not being fearful of that. Being, like, you don't have to nail it and it doesn't have to even go right, but like, you have to try. If this is what you ultimately want, like, what's the path toward trying? So Practice Brave just turned into a movement that then also supported business, because I was starting to work with so many athletes who were in a similar season. Then I was working with coaches that were like, well, now I want to take what I know, what I've learned, and I want to start a small business. And there's just so much fear and imposter syndrome that surrounds so much of our experiences, no matter what area it might be in. And it's learning to practice brave through all of that toward what we want to accomplish, what we want to do, our greater purpose, and, just our life. Like, it really is a series of small steps toward being brave.
I really love what you're saying, because when I think about life, where the growth comes and where the good feelings come are really when you take those risks. And if you don't ever go for it or don't take any risks, you'll never know.
Right.
And you won't have that opportunity to grow.
Right. And
so it sounds like
and we
really
see it too. Like, that's our data to go off of, is like, hey, remember that one time you did that thing that you were super scared to do, but like, you took a tiny step toward it. You were brave for a second. You were brave for one decision. And look what that led to. Like, that is our series of data points that we can carry with us through the rest of our life.
Right. A new friend, a new experience, a new opportunity.
Yeah, right.
Absolutely. Any last words of wisdom that you want to impart to any mothers listening, or I should say any parents listening?
Yeah, I think, such a central theme to the work I want to put out into the world is, your athleticism does not end when motherhood begins. Your career does not have to end when motherhood begins. Your identity does not have to halt when motherhood begins. There's so much more to you than what you even realize, and it doesn't have to stop when you become a mom. It will evolve, and like, allow it to evolve instead of going back. How can we shift that focus of practicing brave moving forward?
So well said. I agree with I'm just thinking as you're talking, it resonates so much with me, because it's also true.
Yeah.
You can't be as athletic as you were when you were 20, but you can embrace how you are today and grow with it.
Yeah. And, and maybe you will be more athletic than you were at 20. Like, who knows? But like, there's so much potential ahead of us. Potential is just going to look different in each category of our life. And it is such a gift to have that opportunity. And if we have that privilege, we got to take it.
And as they say, it takes a village raising children. So having a coach like you, that's also a gift and a privilege.
Yeah. I mean, I'm happy to, it is a privilege to have a platform, to have a business that creates a lot of accessibility for people to have the support that they need. And that was a huge motivating factor. Was it shouldn't just be people who happen to find me on Instagram, who then happen to send me an email and they get some guidance or information. Like, how can we get this information out into the world, and then not just stop at my voice, but how can we, link arms and bring in OBGYNs and pelvic floor physical therapists and CrossFit coaches and running coaches and boot camp coaches? Like, how can we all link arms to better support this population? And that is what creates a lot of accessibility and spreading this effort.
Now, where can people find you if they want to look into having a coach like you? Where can they find you?
Yeah, you can pretty much find everything you need on my website. It's BriannaBattles.com. That's Brianna with two N's, Brianna, Battles, Battles.com. I'm on Instagram at Brianna.Battles. And then the brand page is on Instagram is at pregnant.postpartum.athlete. So that one's a little bit long, but that's where we have a lot of really specific information for training during pregnancy and postpartum, or those who work with that population.
And I'll make sure and describe it all below.
Yeah. Oh, and the Practice Brave podcast. That's where we get a lot of awesome people, including yourself, on there to give some good information.
It's a great podcast.
Thank you.
All right. Well, thank you so much, and we'll talk soon.
Thank you for having me. I really appreciate it.